Sex is often portrayed as a pleasurable and effortless experience. However, the reality is that many individuals, regardless of gender, experience pain during intercourse. It's important to remember that pain during sex is not something to be ashamed of. It's a common issue with a variety of potential causes, both physical and psychological. Pain during sex, also known as dyspareunia, can manifest in different ways. Some individuals may experience pain at the entrance of the vagina, while others may feel deep internal pain during penetration. The pain can be sharp or dull, constant or intermittent, and it may vary in intensity. It's crucial to understand that experiencing pain during sex is not normal, and seeking help is essential. Ignoring the issue can lead to emotional distress, relationship problems, and a decreased sense of well-being. Pain during sex is a sign that something is wrong, and it's your body's way of communicating that something needs attention. By understanding the potential causes and seeking appropriate help, individuals can overcome this challenge and enjoy a healthy and fulfilling sex life. There are various physical reasons why someone might experience pain during sex. These can range from easily treatable conditions to more complex medical issues that require specialized care. Identifying the root cause is the first step towards finding effective solutions and relief. One common physical cause is a lack of adequate lubrication. Vaginal dryness can be caused by hormonal changes, certain medications, or simply not being aroused enough. Insufficient lubrication can lead to friction during intercourse, resulting in pain and discomfort. Other physical causes can include infections such as yeast infections or sexually transmitted infections, which can cause inflammation, irritation, and pain. Structural issues like a tight hymen or vaginismus, a condition where the vaginal muscles involuntarily spasm, can also contribute to painful intercourse. Underlying medical conditions such as endometriosis, pelvic inflammatory disease, or irritable bowel syndrome can also manifest as pain during sex. These conditions often require specialized treatment and management to alleviate symptoms, including pain during intercourse. Two conditions that deserve specific attention are endometriosis and vaginismus, as they are common culprits behind painful sex. Endometriosis occurs when tissue similar to the lining of the uterus grows outside of the uterus, often on the ovaries, fallopian tubes, and tissues lining the pelvis. This can cause chronic pelvic pain, particularly during sex. Vaginismus involves involuntary muscle spasms in the vagina, making penetration painful. It's believed to be a combination of physical and psychological factors. Both conditions are treatable with proper diagnosis and individualized treatment plans. While physical factors play a significant role in painful intercourse, it's crucial to acknowledge that the mind and body are intricately connected. Psychological and emotional factors can significantly influence our physical experiences, including sexual experiences. Psychological distress can manifest physically, and in the context of sexual activity, this can lead to pain and discomfort. Stress, anxiety, and past trauma can all contribute to painful sex. When we are stressed or anxious, our bodies tense up, including the muscles in the pelvic floor, making intercourse uncomfortable or even painful. Past sexual trauma can also create a complex web of emotional and physical responses that can make engaging in sexual activity challenging and painful. The body may instinctively revert to a protective mode, causing muscle tension and pain as a way of defending against potential harm. Understanding the mind-body connection is essential in addressing painful sex. Addressing psychological and emotional well-being alongside physical factors can be crucial in finding lasting relief and reclaiming a positive and pleasurable sexual experience. Section 5. Anxiety, stress, and trauma. Unraveling the psychological roots. Anxiety, stress, and trauma can significantly impact sexual experiences, leading to pain and discomfort. Performance anxiety creates a cycle of worry and tension. Fear of disappointing a partner can cause muscle tension, making relaxation difficult. This tension can manifest as pain, fueling more anxiety. Chronic stress impacts our physical and emotional well-being, affecting sexual desire and enjoyment. High cortisol levels from stress interfere with sexual function and increase pain likelihood. Past trauma can create deep-seated responses, making sexual activity challenging. Communication is key. Open and honest communication with your partner is crucial. It's essential to remember that you are not alone. Express your feelings and experiences in a safe environment. Explain how the pain makes you feel physically and emotionally. Encourage your partner to listen without judgment. Communicate your needs and boundaries. be specific about your limits. Explore alternative ways of being intimate. Intimacy is about connecting on multiple levels. Communicating openly fosters a deeper connection. Section 7. Seeking help. Finding the right medical professional. If you're experiencing pain during sex, it's essential to seek medical advice from a qualified healthcare professional. They can help determine the underlying cause of your pain and recommend appropriate treatment options. Start by finding a healthcare provider who is knowledgeable about sexual health and makes you feel comfortable discussing intimate issues. This could be your primary care physician, a gynecologist, a urologist, or a specialized sexual health clinic. During your appointment, be prepared to discuss your symptoms in detail, including the location, type, and duration of pain. Your healthcare provider will likely ask about your medical history, medications, and sexual practices to get a comprehensive picture of your situation. Don't hesitate to ask questions and advocate for your needs. If you feel dismissed or unheard by your healthcare provider, it's okay to seek a second opinion. Finding a healthcare professional who listens compassionately and takes your concerns seriously is crucial in receiving effective care. Section 8. Practical tips for managing pain and finding pleasure. While seeking professional help is essential, there are also practical steps you can take on your own to manage pain during sex and rediscover pleasure. These tips focus on reducing discomfort, enhancing relaxation, and promoting a positive and enjoyable sexual experience. Using a high-quality lubricant can significantly reduce friction and ease discomfort during intercourse. Experiment with different types of lubricants to find one that works best for you. Water-based lubricants are a good starting point, as they are safe to use with condoms. Prioritizing foreplay is another crucial aspect of minimizing pain and maximizing pleasure. Engaging in extended foreplay allows for adequate arousal and natural lubrication, making penetration more comfortable. Explore different forms of foreplay that you and your partner find enjoyable. Experimenting with different positions can also help alleviate pain. Certain positions, such as those where you have more control over the depth and angle of penetration, may be more comfortable than others. Communicate with your partner about what feels good and explore different options together. Section 9. Lubrication, foreplay, and experimentation. Enhancing intimacy. Let's delve deeper into the practical aspects of managing pain and enhancing intimacy. Lubrication, foreplay, and experimentation are key elements of a pleasurable and comfortable sexual experience. Lubrication is essential for reducing friction during intercourse, especially if you experience vaginal dryness. There are various types of lubricants available, including water-based, silicone-based, and oil-based options. Water-based lubricants are generally safe for all types of condoms, while oil-based lubricants can weaken latex condoms. Foreplay plays a vital role in preparing the body for sexual activity, both physically and emotionally. Engaging in extended foreplay allows for increased blood flow to the genitals, natural lubrication, and heightened arousal, making penetration more comfortable and enjoyable. Experimenting with different positions can also make a significant difference in managing pain. Some positions allow for more control over the depth and angle of penetration, while others can minimize pressure on sensitive areas. Communicate with your partner, be open to trying new things, and find what works best for both of you. Section 10. Rediscovering yourself, building confidence and body positivity. Painful sex can take a toll on your self-esteem and body image, leading to feelings of inadequacy and self-doubt. It's essential to remember that your worthiness and desirability are not defined by your sexual experiences. Embracing body positivity and cultivating self-compassion are crucial steps in reclaiming your sexuality and rediscovering your sensuality. Challenge negative self-talk and replace it with positive affirmations. Focus on your strengths and the things you love about yourself, both physically and emotionally. Surround yourself with supportive and encouraging people who uplift and empower you. Exploring your body on your own terms can also be incredibly empowering. Masturbation can be a fantastic way to learn about your body, discover what feels good, and build self-confidence. Experiment with different sensations and techniques to find what brings you pleasure. Remember that healing and rediscovering yourself is a journey, not a destination. Be patient and kind to yourself and celebrate every step you take towards embracing your body and reclaiming your sexuality. Section 11. Hope for healing. Embracing a positive and fulfilling sexual life. Experiencing pain during sex can be isolating, but remember, you are not alone and there is hope for healing. Seek help, communicate openly, and explore solutions to cultivate a positive sexual life. Define your sexuality on your own terms. Prioritize your needs and desires. Embrace a holistic approach to sexual health. Engage in joyful activities, manage stress, and seek support. Sexuality is a journey, not a destination. With support and self-care, create a pleasurable and fulfilling sexual life.